getting on with daily life as the daily figures begin to rise again. Statistics show almost 300,000 people in Scotland had COVID last week. But is that being felt by members of the public?
We were really understaffed for a while because everyone was just off, and you can't really say anything about it. Just they tell you that they've got COVID, you just have to kind of live with it.
I think people are just accepting that, not for those shielding, but for those who are kind of the same level of risk, are just saying that this is going to be a normal part of life and they're just trying to get back to normality.
I work in the hospital, so I believe that there are plenty of admissions, but it's not as severe. And people aren't suffering as much and are recovering better.
Everybody's looking forward to taking off the mask and then going back to normality, so we'll see how it goes anyway.
The removal of masks from the classroom last month remains a problem for teachers. They argue it puts them at risk, and the high number of absences among staff and pupils is causing concern.
I just feel that this is something that we well could have planned for. This is the third year in a row that we are going to see disruption to the exam system and to the education year. Yet, we are just plodding along as though everything is fine and, we'll all get through it. And no doubt we will, but I think it's going to cause chaos and a big mountain for everyone to climb later.
Over 1,600 people have been admitted to hospital with COVID, the highest it's been since February 2021, whilst we were in lockdown. A subvariant of Omicron called BA2 is driving the current rise in cases.
It's a combination of things. It's a combination of people, the population going out and about, more bigger gatherings, for example, the rugby and the football, and the infectivity of the virus and Omicron, particularly at the moment.
The Health Secretary says current figures are a concern as he launched a new national strategy to rebuild the NHS through recruitment and retaining staff.
First of all, control COVID and the transmission of COVID, that will help. But secondly, make sure we invest in the wellbeing. And the government, since I've been Health Secretary, have invested £12 million in the wellbeing of our staff. We'll continue to look to see what more we can do, but that's why nurturing and taking care of the wellbeing of our staff is a golden thread right throughout this entire workforce strategy.
But Scottish Labour say the strategy is light on detail.
It takes no account of vacancies, no account of early retirement, there's no reference to workforce stress or indeed to low pay, and it's hampered by a lack of data. And after 15 years of an SNP government, that's quite a damning indictment.
It's less than 2 weeks until Scotland's COVID legislation is scrapped. How the public learns to live with the virus may take a bit longer. Ivana Holland, STV News.